Today we have a wonderful patient who had lost almost 100 pounds, and she is 68 and wants skinny arms. So with her weight loss, she has lost a lot of skin and fat throughout the rest of her body, but one problematic area is this triceps area, or this upper arm. So what we're going to be doing is what's called a brachioplasty. That's the medical term for an arm lift, or more technically, an arm reduction. First thing I'm going to do, liposuction of the arm here, getting rid of the fat. Second thing I'm going to do is I'm going to make an incision from the armpit out to the elbow, and her end result should look like this. This is what I'm going for. So to achieve that, I'm going to remove the excess skin from that line all the way to that back line. And you can sort of see what I can pinch out here, and we're going to get our nice skinny arms. In addition, what we're also going to be doing is a face and neck lift, where I make an incision around the ear, dissect down to the mid-face, dissect down to the neck, and really sweep her neck back and sweep her face back. So what we have on the face is a lot of hanging skin in the neck here. And if you just do liposuction in the neck, that's not really going to fix the problem. The problem is a skin problem. So to redrape the skin on the neck, the best way I find is to make an incision around the ear, around the back of the ear, go down to the neck, and sweep it up like that. Also on profile view, you can sort of see that excess skin and fat right in there. The neck lift, part of the facelift, is going to get a much more contoured look like that. And through that incision in front of the ear and back of the ear, I'm going to go down to the lower 2/3 of the face, the cheekbone here, the mid-face, and the lower portion of the face here on the mandible, and really going to sweep that back and sweep that up sort of like that. So that's what we're going to achieve with our facelift. The medical term for that is called a rhytidectomy. That's kind of a fancy word. Just remember facelift and neck lift. So let's go to the operating room and I'll show you how we do it.
I'm very happy I found Dr. Katzen to get rid of the swing. This is the most embarrassing thing when you're going out. And I worked hard to lose the weight. I worked hard to build muscle. Now I'm ready to see the results.
Yay, let's do it.
Yay.
So we're taking out about 300 cc's out of each arm. So basically this patient has a lot of excess fat and skin of the arms. If you just do lipo, as we just did, she's going to have hanging skin. She's not going to be happy, so you got to remove the skin. If you do a little crescent incision, a T incision, these mini arm lifts, it's going to do nothing to the distal arm, this part of the arm, the elbow. You got to make the incision from the elbow to the armpit like that. It's going to hide nicely when her arm's down by her side. This scar is going to be hidden because her arm's going to be down by our side. So now we're going to get rid of all the skin from there to this line down here. And so all this will be pinched out. So here I make a 90-degree stab. I don't take out this triangle for all you plastic surgeons watching out there. I bring this together like that. I work out that dog ear secondarily. That means after I've resected this. And then we're pretty sure we can just go ahead and cut that, but we don't want to be too daring, so I'm going to go clamp by clamp here. You could cut it that way and then take out each little square, but that's a lot of unnecessary cuts, and then there's associated bleeding with that, so we don't want to necessarily do that. That's a pretty healthy specimen from the arms. And that's a lot of excess skin and fat on the arms. You can see she's got really skinny arms now and without any overhang. So that's in my opinion, excellent arm result. And we're done with the brachioplasty, arm lift, arm reduction. Incision goes from the armpit out to the elbow. Nice skinny arms. Remember, I got rid of all that excess skin. And her arm shakes by her side now. All that excess skin is gone. So I think she has an excellent result. When her arm is down by her side, you're not going to see that incision because it's going to be covered on the inseam of the arm. Some of the plastic surgeons will put the incision on the back of the arm there, highly visible scar. You don't like that, you don't want that, because when your arm is down by your side, then you see that scar. On the inside of the arm, between the biceps and the triceps, is the place you should be putting these scars. Now we're going to move on to the facelift, and we're going to lift all the excess skin and fat from the neck and the cheek in here. Boom. You see how that face kind of came up right there? See this pull? Think of yourself grimacing. That's the cheek coming up. This is the SMAS layer, S-M-A-S. And that's the tight layer on the face to really get the facelift. The next step is the SMAS plication. SMAS is a level of the fascia, or fascia, people say it in English, above the muscle on the face. so right now we are doing what's called plication. And in this case, plication means we are plicating or bringing together. And in this case, we are bringing together the platysma muscle. That's the frog neck muscle that brings together your chin and your clavicle. It connects your chin, your mandible, to your clavicle, your neck bone, if you will. And as we age, that muscle becomes more apparent because we lose fat in the neck, and the muscle creates these bands. So in this patient, as you can look at her preoperative pictures, the band, she had a central band here right in the middle, which was pretty apparent. You know, what we're going to do here is bring the muscle together to eliminate that band. So we're done with our face and neck lift. So I made that incision up high above the ear here, goes in front of the ear, and then in back of the ear down there. Then I dissect here, all the way out to here, down here, all the way across the neck, make a small incision in the neck, and then I plicate the muscle, the platysma muscle there and there, getting our nice chiseled 90-degree neckline. From basically about here up to the menton, the bottom of the chin there. So from there, in there. Internal sutures, permanent. Then I make a SMAS plication, lifting the SMAS, the facial layer of the midface up by making a plication from there out to there. Another plication on the inside from there to there, bringing the face back. So that vector brings the face up and back and adds some volume to her cheek. Then we get rid of the skin, and what I did is I took the skin that was originally here, pulled it up, and it's behind this ear here now. And then we just taper out the dog ears in the front and in the back to get a nice smooth look. So I think she has an excellent result. That's how I do a combined facelift and arm lift on a patient that had lost about 100 pounds. And remember, again, she's 68, so it's never too late to do these surgeries. Thanks for watching. Please subscribe. We'll see you next time.